In Ayurveda, the treatments are personalized. Every person is considered to be an individual because each person has a physical constitution which is different from other person. In Ayurvedic consultation or in Ayurvedic diagnosis, we are first of all trying to find out what is the root cause of problems. So in Ayurveda, the root cause of the problem is not necessarily some kind of bacteria or virus, but it is something beyond that. In Ayurveda, we have three types of root energies, or three types of dosha, we call them: Vata, Pitta and Kapha. So when we are trying to find out the root cause of the problem, we are trying to find out which dosha is out of balance, or we sometimes also find out if there is a mental involvement, means if mind is stressed, if mind is having any kind of disturbance or stress, or there is an emotional problem, or maybe something in the family, in the relations. So all these factors have to be considered before we come to the conclusion. Of course, in order to find out the Vata, Pitta, Kapha, there are a few types of examination that we do. One of them is pulse examination. Like if the patient is sitting here, so we try to check the pulse. Pulse is usually checked at the root of the thumb. So we check the pulse and we are trying to see under which finger out of these three fingers, under which finger is more pulsation. So basically trying to locate which dosha is out of balance. In this case, like I find there is more pulsation under the first two fingers, so I can say Vata and Pitta is out of balance. Then we also confirm these things by other examination, like we would like to check the tongue of the patients. Can you show me your tongue? Maybe this size, yes. So in the tongue we are looking for if there is a coating or no coating, like you can see the white coating. This again confirms, thank you. This confirms that the white coating on the tongue confirms that the digestion is not proper. Something is wrong with the digestion. We also look at the eyes of the patient and the physical structure, body, if there is anything wrong with that. Another type of examination is, we call it, like we ask questions like what is the problem. So if I may ask you, what is your problem?
Ja mam problem ze stawami, mam bóle stawów i problem ze strunami głosowymi.
Pain in the joints? Huh?
Yes.
And thyroid problem. Okay.
Yes.
So when she says she has a pain in the joints, so in Ayurveda we try to find out why she has pain in the joints. And as I just checked the pulse, I was trying to find out there is imbalance of Vata and Pitta. So this actually shows that maybe the digestion is not very good. Whatever she is eating is not completely digested, and as a result of that some mucus is formed in the stomach. This mucus is called ama. This ama then goes, circulates and deposits in the joints, and that is how the joint pain starts. So in Ayurveda, that is how we make the treatment. Of course, we ask the history, family history, if there is any other history in the family, so that we can make a genetic relation or some other type of family relation. In addition to this, we ask many questions about how is the bowel movements, for example. Like, do you go to toilet every day?
No.
Not every day.
Not every day.
Second day?
Yes.
Okay. So this again confirms our diagnosis of Vata Pitta, because when you go second day, you are not cleaning all the toxins from the body. So that means the toxins are being deposited in the body. How's your urine? Much? Okay, normal? No problems?
No problems.
No any burning sensation or something?
No,
Okay. How's your appetite?
I think it's good.
Strong appetite, medium or low? Medium appetite. Okay. And after eating food, do you get sometimes some digestive problems? like little bloating
Yes.
gas. Okay, so again it's confirmed, as I said, because with the pulse, actually I checked the pulse first of all, because with the pulse we can actually find out the whole body situation if we are really expert in the pulse diagnosis. So when I checked the pulse, I said vata pitta, and I said digestion is the problem. So she is now confirming that she has problem. After eating food, she has little flatulence or some bloating or gas, which proves that there is problem in the digestion. Also, the coating on the tongue shows that there is some problem. Also, we ask questions about maybe other things like sleep. When we are asking about sleep, we are trying to find out how is generally the mental state. So, do you sleep well?
Yes.
Deep sleep, or you have some light sleep?
Sometimes I have a problem in the evening.
In the evening,
Yes.
to fall asleep.
Yes.
So when she has a problem with the sleep, it indicates that there may be something for the mind. Maybe mind is not completely relaxed. Maybe something is going on in the mind. Then we ask questions about mind also directly. Generally, your mind is relaxed.
No.
Or stress?
Stress.
Stress. So this is again because she has also mentioned thyroid. Now thyroid problem, according to Ayurveda, is of course according to modern medicine also, is something which is connected with the endocrinal system, means the hormone secretion is disturbed. In the modern medicine also we say that when the hormone secretion is disturbed, there is something in the nervous system, because brain is controlling everything. So again in Ayurveda, brain is the functional area of mind. So therefore when she says that some stress is going on, she cannot sleep sometime properly, this confirms that mind is also involved in this problem. Maybe not only the joint pain but thyroid problem, mind is also involved. Sometimes we also go beyond this and ask a very personal question to the patients about how are their relations, because now we are trying to find out if the patient has any emotional support, or the patient is just feeling lonely, or patient is suffering from some kind of emotional trauma. So how is your relations? Do you think it's okay, not okay?
Not very okay.
Not very good. So this again confirms when she says relations are not okay. So when in Ayurveda we are trying to ask many questions, I am already building up my diagnosis so that I can give a proper treatment. So in her case, if I say at the physical level, vata and pitta. Vata is responsible for nervous system functions, for sleeping, for different type of mental activities, of course movement. She has a constipation, which again proves that vata is out of order. She has digestive problem, which proves pitta is not functioning properly. So overall, if I make a diagnosis, she has a problem with vata and pitta, and of course mind is also involved in this. Mind is also playing an important role. So when I design a treatment for her, I will mainly work on two things. One, I will like to balance vata and pitta, means bring vata and pitta down. Second, I would like to relax the mind, because if the mind will be relaxed, then brain and nervous system will be functioning more properly.